acquiring data for almost 40 years, since Homer Warner really came up with the concept of decision support and automating data to support decision support. And through that process, this data has become very usable and very important to all the industries within healthcare, life sciences, and across the board. We've developed a lot of insight based on that data, and we've partnered with Deloitte to take that insight, to expand it and use it with other organizations to really help advance healthcare and innovation in healthcare. So Deloitte's really the arm that's going to take this data and provide it out to others, the insight, not the data. I think that's really important because PHI is really important to us. But that's the partnership with Deloitte, is to share insights around clinical data and how it can improve healthcare. We have something called the Homer Warner Center, where we have 20 medical informaticists, and a big part of their role is to use that data to prove out research and analysis, whether that be around diabetes or whether that be around asthma and the impacts of certain drugs or the impact of certain procedures. They gain insight by using their hypothesis and the data that we have, and then we provide that insight out for other members of the industry to use to improve what they're doing in healthcare. Yeah, so we are really fortunate because we've invested for a long time in data, and it's turned into big data. And the conversation we just had about analytics and Deloitte. But really, a lot of our insight, our learnings, have come from others. We're kind of famous for our 39-week induction protocol, which is really helping mothers and babies. We learned that through other research from other organizations, and then we were able to apply it through our systems. My advice to anyone would be, including the smaller organization, is let's learn from each other and let's share that knowledge. And we're not really competing in healthcare, we're trying to do better. And that would be my advice. Let's learn from one another and let's share what we have, and all ships will rise. I agree that the schedule is incredibly aggressive and that we have made good progress, but we're putting tremendous pressures on this industry. Being a CIO in this industry, I'm pretty acutely aware of it. With the collision of ICD-10, with all the work that Meaningful Use is asking, yeah, I think we ought to be refocusing our efforts not so much on new functions and features that we're going to ask the vendors and providers to do, but more on how are we going to get the benefit out of what we've already asked people to do. And I think, luckily, there is some momentum to do that. The last HIT Policy Committee, that was a focus of the conversation. And I have great hope that we're starting to realize just how much we're putting on the backs of this industry, and we're going to get some real good benefit out of Stage 3.